But I'm going to assume most of you have been down the traditional physical therapy path and it probably didn't work out super well. And that's why you found other forms of dealing with your pain. So let's just gloss over what traditional physical therapy is because it's everything that stability and wellness is not. We are not traditional physical therapists. So, traditional physical therapy is this beautiful image I have on the right of the screen of this physical therapy clinic. You can see in the back, there is a woman who has probably been told, this is the exercise you do. You remember this, go do it. She is all by herself on an island. She doesn't know if she's doing it right or wrong. We don't know what muscles she's using. It could be the wrong muscles in a compensatory pattern to accomplish whatever she was told to do. Over on the left of that picture, we have what I think is probably the physical therapist. She has her hands on, she's doing some manual work, maybe some cueing with that patient. And then in the front of us, we have who I suspect to either be a PT assistant or a technician who is, technicians are usually like 20 years old. They do not have bachelor's degrees yet. And she is just helping that man on the bike. And by shared care, I mean all three of these patients are that physical therapist on the left. They have the same time slot. How much do we think is going to actually get accomplished in 1 hour of care when you're sharing one therapist between three patients? Not much. There's only going to be so much care between as she can give with hands-on techniques and exercise cueing and appropriate planned progression. And in traditional physical therapy, you're not always with the physical therapist. That gentleman in the front is not with a physical therapist. You also need more visits to achieve the results that you want. So if you can only get 10 minutes of manual therapy and only a little bit of corrective exercise, you're going to have to come in more. It's just going to take longer to get the results that you want because you're not getting the personalized care that you should be getting to get better. The therapists at insurance clinics, traditional clinics, are also limited by insurance constraints. For example, insurance might only cover 6 visits, and then you have to resubmit for them to cover more. Insurance will dictate, hey, I know they're here for knee pain, so you better only treat their knee, even though we all know that knee pain usually comes from a problem at the foot and ankle, as well as the hip, and sometimes even the lower back. But insurance won't allow you to treat other body parts. They won't cover it. And so you're limited to that. And because of all this, you're limited to inside the box treatments. So being in the insurance clinic, you better do what insurance says or else they're not going to pay. So you are limited. Now, non-traditional physical therapy is where we come in. We are root cause focused. We do not chase symptoms. We come in with that magnifying glass and we are looking out for where is this pain actually originating from? Because you have knee pain, but it's probably coming from the hip, like I said before, or the ankle and the foot, or a combination of both. So we're not just chasing symptoms. We're looking to make long-term transformation. And that's something insurance just won't cover. They will not get you to becoming a professional paddleboarder again. They won't get you back to being an equestrian or running with your grandkids. Whatever is important to you in your identity, they just want to make sure you get pain-free and then you're done. So we find the root cause of your pain. Everything is always one-on-one. We don't have assistants. We don't have technicians. The hour is yours and your therapist. We have an emphasis on hands-on techniques. So that might be sports massage, cupping, dry needling, joint mobilizations, tactile cueing, you name it. And we are dead set on moving well. So unlike the woman in the photo in the back right here, we don't know how she's moving. The therapist has no idea. She doesn't know. She's just doing some semblance of what she thinks she was told to do. Versus we are dead set on making sure you're moving well. We have our hands on to make sure the right things are firing. If it doesn't work, we dumb it down. We scale it back to what is going to get you firing those muscles properly. And then we implement an appropriate progression. We have out of the box thinking because we are not constrained by insurance. So we can do all kinds of treatments that we feel will benefit you. And we always collaborate with other specialists that might be involved in your care. So our approach at Stability and Wellness is finding the why behind your pain and then keeping you pain-free. So a lot of our patients come to us with an initial complaint of pain. And so you think, oh yeah, physical therapy, I'm going to do that. And so we address the root cause. But then when the pain goes away, sometimes we need to see you a little bit longer in order to ensure that the root cause is fully addressed. Because pain is what you feel last. Pain is a breakdown in your body's ability to move properly. And so that happened before you felt pain, and now you're feeling pain. When we get rid of the pain, we need to restore proper movement. And you will be pain-free when we are working on the root cause. So it's important to just know that if we address the root cause, that's going to be part of keeping you pain-free. We are more than just a clinic, we're your wellness partners. So again, you come in with a certain complaint that prompts you to see a physical therapist, but then we have wellness offerings such as Pilates, performance training, sports massage, cupping, dry needling, and maintenance visits so that you can remain pain-free and moving well. And who better to deliver these services than a doctor of physical therapy? It's safe. We have the anatomical knowledge and biomechanical knowledge that a personal trainer, a massage therapist just can't match. And so we know that we are doing appropriate and safe exercise, soft tissue release, and so on. We do, that being said, understand our own limitations. We can't fix something that might need surgery or an injection. I can't fix a fractured bone. I can't fix a torn ligament, right? So we will make appropriate referrals to specialists when needed. So how can you get started with physical therapy if you're interested? Well, we schedule the initial evaluation and we do a very thorough evaluation and determination of root cause of your pain and symptoms. And then we begin personalized treatment. It's that easy, guys. So once we've identified the areas to improve, we begin a tailored plan just for you. And in the middle of that plan, you'll start to feel better, right? Most people do. But we want to continue on to step 3 and unlock your ultimate potential. So if you want to get back to running around with your grandkids, picking up your grandkids, CrossFit, running a marathon, that's where we get into more of the physical therapy transitioning into wellness. Because if you're pain-free, insurance won't cover it. They think everything's fine and you're well. But with consistency, you're going to start to feel better. And we don't want to stop when you're normal, like insurance would. We want to aim to help maintain the wellness in your life. So getting you to those goals that insurance just wouldn't cover.